So I'm here today with Dr. Hayden Pasco at Whole Health Physicians. My name's Amanda Harris. I am the owner and founder of Re-Kinect, and I asked Dr. Pasco to talk to us a little bit about Whole Health Physicians. So Whole Health Physicians is a concierge practice here in Richmond, Virginia, and I'm just curious, Dr. Pasco, with all these concierge practices popping up around Richmond, what led you and your partner, Dr. Neely, to start Whole Health Physicians?
So when we set out to start Whole Health, we looked around to see if there was any other practice that we could join. Our idea was not to start our own office.
Oh, okay.
But when we looked around, we realized even in the concierge world, the priorities were wrong. That really it needs to be about the patient.
Yes.
And the patient gets lost in the mix when you're owned by a holding company or you're owned by a hospital or you're looking to sell a business. The patient gets lost in the shuffle. And what made us want to go to medical school was to be able to help patients, to be able to advocate, to really understand how all your body systems are working together and to make you healthy. Both Dr. Neely and I believe very strongly in good prevention and that we really need to treat the person as an individual. So when we got to the drawing board and tried to decide what we wanted to do, we felt like we needed to have the time with our patients. We spend about 3 hours with patients during their physical so that we really understand what their nutrition is, what their worries are, what their lifestyle is, what diseases or abnormalities have come up in the past, what might be troublesome for them in terms of an action plan, where they are in terms of how they want to treat it. Do they want to do things naturally? Do they want medicine because they're busy and they want an easy approach? And we want to take all of that into perspective as we work with the patient to develop a plan. And we don't want to feel rushed. We don't want our patients to feel rushed. We want to know them like family, and I think that's what we're achieving here. And we're very strict about limiting our patients because we don't want anything to get in that way. We're happier physicians that way. We feel more rewarded. We have more time to do our research, and I think patients are more invested if we can do it that way.
So in your mind, other than your beginnings, which I think that's a great story, tell me what makes Whole Health Physicians unique?
I think our acknowledgement that we're all individuals. So obviously we went to medical school and we know the standard of cares and we understand that there are algorithms to treat disease, and we do that. You know, if there's a problem, that's what we're going to do. But we also acknowledge that we're not a system of pipes. We're not a cardiovascular system and a GI system and a nervous system that are all working independently. That there's so much more. And unfortunately, our world and our crazy medical system is we are having to specialize out so many processes. And I think you do have to do a little paradigm shift and say, look, okay, if we want to treat a disease, what's the root cause? Where? And sometimes it's not going to be an obvious answer. So I feel like with Whole Health, we have one foot in kind of more of a naturopathic approach, and one foot in allopathic medicine. And I don't think there's any other group in town that's really acknowledging both sides and working with the patient to get them healthy. And I call it aggressive prevention because I feel like you have to know yourself, know what's going on in your body. And when you see it in black and white, or you see it and you're talking about it, you have a plan and you can act on that plan. And then we set mileposts up. So the other part of what we do is making sure that you're following up. Some people need to follow up every month. Some people don't need to follow up every month, and it can be much more spaced out. But we have a plan and we have goals that we're measuring.
Yeah, that's great. And I know with a couple of the clients, for me, patients for you, that we have shared, I've really liked and appreciated the fact that you'll reach out to me every once in a while and say, hey, have you seen so-and-so lately? So just taking that real active role in their care, not just medically, but also these other activities that you've recommended that they do, making sure they're staying on top of that. And you know that if you're not getting updates from me, that probably means they aren't coming in, right? That's why you would reach out.
It's about building their community. So
Yes.
I talk a lot like with when patients come in, I want to know who their team is.
Yes.
So you're a very important part of their team in terms of getting them to a better place and wellness. So,
and you've got these resources that you call on for various patients depending on what their needs are.
I am not an expert in everything.
Do you have any tips that you could give our viewers to live a healthier, more robust life based on your experience as a physician?
That's a tough one because it's so individual.
And there are so many, right?
There's
so many aspects.
There are a lot of aspects. So it's mainly, I think the self-reflection is really where everybody has to start. Getting that head out of the sand and saying, okay, here's the family and the genetics that I'm coming from. Genetics don't predetermine what your health is going to be,
right?
But maybe a tendency. So
sure.
Being able to recognize where you came from, looking at your lifestyle, and just stress is so important on everything. It causes
or at least
diabetes
managing
and hypertension
stress.
and vascular disease and GI disease and musculoskeletal problems.
Yeah.
So looking at where you came from, looking at your day-to-day life, looking at your psychosocial environment, how can you improve that? Those are all things you can start. You are what you eat, so nutrition is everything.
Yes.
Realizing that we do live in America, and you look to the left and you look to the right, and everybody else is eating all of this delicious food, but we really need to be eating whole, healthy food.
Yes.
And that's a good place to start. I really believe in having a medical team that can advocate for you is everything. I've had plenty of patients go through, when something comes up health-wise, it can be scary, and you just need a good grounded place. Here's where I am health-wise, here are the questions I need to ask. I think we're very quick to pick up the phone and make sure we know the latest medical data and advocate for people. Yeah. But everybody needs that partner. And no one doctor is right for everybody, but you certainly need to have a team that's going to advocate for you, because we're all going to have something.
Yeah. Well, and it's great to have somebody that they can call instead of just going to Google. I have so many clients that tell me they just go to Google, it's like, oh, please don't just go to Google. I think your doctor could help you more than Google. So
sometimes I love Google because it's opening up a community of sometimes there are little nuances, and it educates a patient to
Absolutely.
say, hey, doctor, pay attention to this.
Yes.
But at least ask the doctor, yes. So it can be, it's a blessing and a curse.
Yes, it's a little dual-edged sword, isn't it?
I'm a little spoiled now because my patients will have my email or text me or have a question, and they can get to the bottom of it right away.
Yes.
But yes.
Yeah. Well, that's good. That's good then. So thank you for speaking with us today. And if our viewers are interested in reaching out to you and learning more about Whole Health Physicians, can you give us your website address?
Yes, it's wholehealthphysicians.com.
Great. And your phone number here is?
804-601-4901.
Great. Thank you so much, Dr. Pasco.
My pleasure. We appreciate you.
Thank you.
Yeah.